Welcome to the deep dive. This is where we take that stack of material you shared with us and really get into the important stuff, the surprising bits.
Think of us as, well, helping you get up to speed quickly on whatever topic you've thrown our way.
Exactly. And this deep dive, it's for you.
Mm-hmm.
Today we're jumping into something that, wow, affects a lot of Canadians.
Yeah.
Adverse drug events.
Yeah.
ADEs for short.
Yeah, and you might think, oh, a bad reaction, that sounds kind of rare, maybe.
Right. But the material you sent, it paints a really different picture, especially right here in Canada. We're talking over 2 million Canadians hitting the emergency department every single year because of an ADE.
That's just a massive number.
Yeah.
And it puts a huge strain on healthcare. The info shows these ADEs, they lead to over 700,000 hospital admissions annually.
Wow.
And the cost. Over $1 billion a year for the country.
$1 billion.
Yeah.
That's just, it's hard to wrap your head around,
Yeah.
especially when you hear the next part.
Which is?
The material suggests pretty strongly that 75% of these events are preventable.
Yeah, 75%. That number really stands out. And it gets even more specific.
How so?
Well, apparently, 1 in every 3 ADEs happens because a doctor or pharmacist, a healthcare provider, unknowingly gives a patient the same medication.
Oh, no.
Or one in the same class that already caused that patient harm before.
1 in 3.
Mm.
Just because the information wasn't there. That's kind of shocking.
It really is.
So, okay, that's the core of what we need to unpack today, based on what you sent. Understanding these ADEs, why they keep happening, particularly these repeat ones, and then there's this specific solution mentioned, ActionADE.
Right. ActionADE, we need to look at what it is, how it works, and, its role in trying to improve patient safety and stop this cycle of harm.
And the sources you provided, they cover it from different angles, don't they?
Yeah, exactly. Some define the problem, the scale of it. Others dig into the why behind repeat events. Then there's info on ActionADE itself, the tool, and importantly, perspectives from healthcare folks actually using it.
Got it. So our mission today, unpack what these sources tell us about ADEs, this whole challenge of preventing them, especially the repeat ones, and how tools like ActionADE are trying to connect the dots in healthcare.
Connect care, share information, maybe save lives, and also touch on some wider issues around managing medication info.
All right, let's dive in. First things first. What exactly is an adverse drug event, according to this material?
So the definition provided is pretty clear. It's an unintended and harmful occurrence that's associated with using a medication.
Okay, so not just like a minor listed side effect. We're talking actual harm.
Exactly. Significant harm. It goes beyond just a common expected nuisance side effect.
And as we saw, the scale is just huge. Millions to the ED, hundreds of thousands hospitalized, that $1 billion cost.
Yeah, it really sets the stage. And that stat we mentioned, it's worth repeating.
The 1 in 3.
Yeah, 1 in 3 ADEs are repeats because the provider just didn't know about the patient's history with that drug.
So why? Why don't they know? What's the root cause here, according to the sources?
Well, the consistent message seems to be that our healthcare system just isn't well connected. Information doesn't flow easily.
It doesn't follow the patient.
Pretty much. Information gets stuck in silos.
So that leads to these big information gaps, right? Like your local pharmacy team might have 0 clue that you were in the hospital last month because of a reaction.
Or a doctor in one clinic won't see notes from a different clinic, or maybe from a long-term care home you stayed in. The information just isn't shared effectively between those different places.
Now, what about technology? There's been a lot of investment in electronic medical records, EMRs.
Right, but that's part of the challenge highlighted here. Often these systems, these EMRs, they can only share information easily if everyone is using the exact same system.
So if the hospital uses system A, and the pharmacy uses system B, and the clinic uses system C,
then getting that crucial alert about a past ADE from one to the other becomes really difficult, sometimes impossible. Communication breaks down.
The material had a specific example from BC, British Columbia, that really illustrates this, about PharmaNet.
Yes, PharmaNet. It's the province-wide network that tracks dispensed medications. Before ActionADE came along, apparently information about ADEs very rarely made it into PharmaNet.
Even though there's a spot for it, like a field for adverse reaction.
Exactly. The field exists. It's a free text field, but hospitals, clinics, long-term care, they just weren't consistently putting the ADE details in there.
So the database was there, but the crucial safety info wasn't getting in or wasn't being shared effectively across different healthcare settings.
Right. It created this sort of blind spot. And the material points out that right now, Vancouver Coastal Health, which includes Providence Health, is the only health authority in BC that's routinely putting ADE info into PharmaNet.
And they're doing that using ActionADE.
Correct. Through ActionADE.
Wow, that really highlights the system-wide challenge. And the consequence of all this disconnectedness, the sources suggest it often falls on the patient
Or their family, yeah.
to remember all these details and try to relay this critical safety information themselves as they move between providers.
Which is, understandable, but also really risky. People forget details or maybe don't understand the significance. It leads to gaps.
Definitely underscores the need for something more reliable, more systematic.
Absolutely. Which brings us to ActionADE.
Okay, so ActionADE, described as a web-based application developed by researchers. What's its main job?
Its core function is to give healthcare providers a way to document ADEs using a standardized format.
Standardized being the key word there.
Very key. It means the information is structured, not just a random note. And then, crucially, it allows them to communicate that standardized info to providers in other health settings.
So bridging that gap we talked about.
Precisely. The main goal, as stated, is to prevent those unintentional re-exposures, giving someone a drug that hurt them before, by making sure the information gets where it needs to go.
How does it connect the information, practically speaking?
Well, it lets a provider, say in a hospital where an ADE is identified, document it thoroughly. Then that structured info gets shared out.
So it can be seen in the community, like by a pharmacist.
Yeah. The material even showed mock-ups or examples of this ADE information potentially popping up right inside common pharmacy software systems.
Like WinArcs or Kroll.
Those are the examples shown, yeah. So integrating it right into the workflow.
Okay, so it's building that communication bridge for safety alerts. Now, the material also talked about the impact, the benefits, right? Especially from the providers using it.
Yes, and it's interesting how they frame it. It's not just seen as like extra paperwork.
More than just documentation.
Much more. They talk about reporting ADEs through ActionADE as being a really critical part of patient care, and even a way they advocate for their patients' safety.
That's a powerful way to put it.
Yeah.
What specific benefits did the providers mention?
Well, pharmacists, for instance, highlighted that it gives them a much-needed platform to properly identify and document the ADEs they encounter.
Something maybe they couldn't do easily before.
Perhaps not as systematically or in a way that could be easily shared. ActionADE allows them to make it part of their regular patient assessment and follow-up.
And it helps them share info out, too.
Yes. One pharmacist mentioned how it makes transmitting that information much smoother. They can notify colleagues out in the community, primary care docs, other pharmacies, about an ADE that put a patient in the hospital.
Sort of closing the loop.
Exactly. And another provider described it almost as a catalyst for change.
A catalyst, how so?
Meaning it's not just the tool itself, but using it encourages better communication overall, leads to more informed decisions everywhere the patient gets care, and hopefully better outcomes. They see it as bridging those really vulnerable points, like when a patient leaves the hospital, transitions between settings.
Improving access to important health info right when it's needed most.
Right, and even just the act of efficiently reporting an ED visit caused by an ADE, that adds to this kind of collective knowledge pool. It helps others down the line make safer choices.
It sounds like it encourages teamwork, too.
Definitely. The sources mention it fosters collaboration, particularly between doctors and pharmacists.
How does that play out?
Well, a doctor might use it to alert a patient's regular pharmacist about a reaction. Or a pharmacist seeing a report might share their thoughts back with the hospital team, or maybe prompt a doctor to request a full medication review from the pharmacy. It opens up communication channels.
Okay, and this better information flow, this collaboration, does it actually make a difference? The material had some stats, didn't it?
It did, yeah. Specifically about pharmacists using ActionADE. They were apparently able to step in and stop potentially life-threatening prescriptions in 36% of cases where they saw an irrelevant ADE report.
Wow, 36%. That's significant.
Huge. And in almost 10% of cases, seeing the report led the prescriber to actually reassess the medication and make some kind of adjustment.
So concrete changes based on the shared information.
Absolutely. And it's not always about stopping the drug cold either.
Right, the material made that point.
Yeah. Even if the drug isn't stopped completely, these reports start crucial conversations. They might lead to finding a safer alternative drug, or maybe just adjusting the dose or setting up closer monitoring for the patient.
It triggers interventions.
Exactly. The sources list things like specific counseling for the patient about managing the drug or its effects, setting up better monitoring plans, reducing doses, maybe treating the side effects caused by the drug, or just having a formal check-in with the prescriber as a safety step. It prompts action.
Now, we should address a concern that came up in the material. The potential worry about stopping a needed medication inappropriately just because an ADE was reported.
Yes, that's a really important nuance to cover, and it's a valid concern.
The example used was hypoglycemia, low blood sugar, for someone with type 1 diabetes taking insulin.
Right. So insulin causes hypoglycemia. That's a known serious adverse effect. Reporting it through ActionADE is vital information.
But you obviously can't just stop the insulin for a type 1 diabetic. They need it to live.
Precisely. And the material explains what the reporting does in a case like that. It's not about stopping the insulin.
So what's the benefit then?
The benefit is that the ActionADE report ensures everyone involved in that patient's care. The family doctor, the pharmacist, maybe an endocrinologist, gets clear, standardized information about that hypoglycemia risk.
Ah, okay. So it leads to better management.
Exactly. It leads to things like improved monitoring strategies, maybe more frequent blood sugar checks, or specific counseling for the patient on how to manage their insulin and prevent future low blood sugar episodes.
So it reinforces the idea. Reporting isn't always about stop the drug. It's about communication for appropriate management, especially when the drug is essential but carries risks.
Couldn't have said it better. It facilitates safer use through shared understanding.
And the overall take from the sources seems to be that ActionAD adds this sort of extra layer of patient safety.
That was the phrase used, yeah. An extra layer of safety in a complex system.
And it really connects back to that mission stated in the material. Connecting care, sharing info to prevent those repeat ADEs, potentially saving lives by plugging those gaps in our fragmented system.
Making sure that crucial safety lesson learned in one place isn't lost when the patient shows up somewhere else.
Right. So to recap our journey here, we've looked at this really significant issue of adverse drug events in Canada. We've seen how common they are, how costly, and crucially, how often they're preventable repeats caused by these communication gaps.
Yeah, the disconnectedness of the system.
And we explored how ActionADE is presented as a solution, a standardized way for providers to document and, importantly, share this critical safety information across different settings.
Aiming for better patient safety, better interventions, better communication all around, it really highlights just how fundamental information flow is.
It really does. And, that leaves us with a final thought for you, the listener, to chew on after hearing all this. Thinking about this challenge sharing vital patient info across different doctors, pharmacies, hospitals.
It makes you wonder, doesn't it?
Yeah. How might this same challenge impact other areas of your healthcare beyond just medication reactions? Maybe on a personal level, what steps could you take to make sure your own important health information, like a past drug reaction or a serious allergy, actually gets communicated effectively the next time you navigate the healthcare system? Something to think about.